Good morning, everybody. Welcome to Keeping the Intervention Going, the webinar hosted by the California Evidence-Based Clearinghouse for Child Welfare, commonly referred to as the CEBC. My name is Molly Dino, and I'm with the CEBC. I'll be moderating today's webinar. Before I introduce our presenters, I'll be reviewing webinar logistics and background info on the CEBC. First, we've muted your phones and computer microphones due to the high number of participants attending. If you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom of the screen, and we will do our best to assist you. If you have any questions for the presenters, please submit them using the Q&A pod, and we will save those questions for the Q&A session conducted at the very end of the speaker's presentation. Please note that this webinar is being recorded and will be archived on the CEBC website for anyone to view within the next few days, along with a PDF of the PowerPoint slides. Lastly, you will receive an email with a link shortly after the conclusion of this webinar to complete a brief survey so that the CEBC can improve our webinars and make them as useful and relevant as possible. For those not familiar with the CEBC, the majority of our work can be found on our publicly accessible website, where we provide plain language summaries of research studies on practices that are relevant to children, youth, and parents involved or at risk for involvement in the child welfare system. The CEBC website currently features over 450 practices that range across 48 unique topic areas, such as mental health, parent training, anger management, substance abuse, and many other areas relevant to child welfare. Anyone can access and explore the information and materials on the CEBC website, and we encourage you to do so if you haven't already. The CEBC is funded by the California Department of Social Services, Office of Child Abuse Prevention, and operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego, California. Now for a little about our presenters. Lauren Brookman-Frazee, PhD, is currently a professor of psychiatry at the University of California, San Diego. She's the Associate Director of the Child and Adolescent Services Research Center, the Research and Training Director at the Autism Discovery Institute at Rady Children's Hospital, San Diego, and faculty in both the SDSU-UCSD Joint Doctoral Program in Clinical Psychology and the UCSD-VA Psychology Internship Training Program. She is a licensed clinical psychologist and board-certified behavior analyst specializing in interventions for children with autism spectrum disorder and other developmental and mental health problems. Jared Martin is the implementation and training specialist for the California Evidence-Based Clearinghouse. Jared's primary role at the CEBC includes providing training and technical support to agencies on the selection and implementation of evidence-based practices. And now I will pass it on over to Jared.
Great, thanks Molly, and thank you everyone for joining our webinar. So I'd like to start out by reviewing our learning objectives for your time with us. So in just a moment, I'm going to hand it over to Dr. Brookman-Frazee, who's going to talk about her research on system-driven implementation within a county mental health system and sustaining multiple evidence-based practices. After she wraps up, I'll take over again and talk about the practical application of implementation science to be used to develop a sustainability plan. So we're going to be talking about data and looking at strategies as well. So keep in mind that this webinar is really designed and intended for system leaders, organizational leaders, or administrators who are in positions to kind of oversee organizational issues, pull data, and also make decisions. So keep that in mind. So we have a series of poll questions that we have for the audience. This is the first one, and we're going to be asking, or you should receive a pop-up. So the question should appear on your screen, and the question is, what service sector do you work in? And so the options are A, child welfare, B, behavioral health or mental health, C, a community-based provider, public policy, higher education, or other. So the poll is open, we're getting responses. Looks like folks are still responding, so we'll give it just a second. Okay, so I'm gonna go ahead and end the poll. And I'm gonna share the results. So it looks like the majority of you are child welfare, followed by behavioral mental health, which is great. So kind of our ideal audience. Another question that we have to get a sense of who is in the room is, what is your position type? So I am going to open that up just 1 second. Oh, there we go. Okay, so go ahead and take a second to indicate if you're in leadership, if you're a manager, supervisor, if you're in direct service, if you're administrative, or if some other role. Okay, so responses are coming in. We'll give it just a second. I'm gonna go ahead and end the poll. Looks like other is the top choice. So we have a kind of a broad range of positions here. So senior leadership is about 25%, 22% for administrators. So that's great to hear. So hopefully this information is helpful for you. One other question. What is the length that you've been operating an evidence-based practice? So the responses are, if you have no experience, A; if you're just beginning, if you have a moderate amount of time, long term, so 12 months or more, or if it doesn't apply, select E. Great, so I'm gonna go ahead and close out that poll. So the overwhelming majority of you are in long-term sustainability, which is great, so 12 months or longer. So this is really good to hear. And then we have one last question for you before we move on. And the question is, how many evidence-based practices are you implementing right now? So the responses are 0, 1, 2, 3 or more, or if you don't know, or if it doesn't apply. So responses are coming in. Give folks just a second. And I'm going to go ahead and end the poll. And looks like it's tie between 3 or more, or if it doesn't apply or if you don't know. Great. So with that, I'm going to go ahead and transition over to Dr. Brooke Minfrzy, who's going to present on her topic.
Thank you, and thank you for having me. I'm very happy to share the research that I've been doing and I want to first acknowledge my close collaborators on this research. So I have funding together with Dr. Anna Lau in the Department of Psychology at UCLA. UC Los Angeles, and we have funding from the National Institute of Mental Health to study the sustainment of multiple evidence-based practices within the context of Los Angeles County Department of Mental Health. So of course this research is conducted in close partnership with Los Angeles County Department of Mental Health. And so I just want to acknowledge are the partners in this research. So I want to start by talking about kind of the framing of implementation research that really guides how we're looking at the sustainment of evidence-based practices in a large system. So really there's, many folks are doing implementation and we are studying implementation, which really kind of distinguishes implementation research, which is really looking at systematically examining methods to promote the uptake of research findings or evidence-based practice into routine care. So we are really with the 4KEEP study that I'll talk about, looking at the process and outcomes of implementation. So I'll just start with a conceptual model of implementation that we often use to just kind of frame our work, and that was outlined by Dr. Enola Proctor and colleagues. That really looks, it kind of defines intervention strategies, the evidence-based practice. So looking at what is being implemented. So that could be specific models, it could be measurement-based care. It's kind of the intervention or the assessment. So the what is being implemented. And then we think about the how. So how, what strategies are being used to implement those evidence-based practices? And we often think about those at multiple levels, which I'll come back to in a bit. And then lastly, we're looking at the impacts of implementation, and really kind of thinking about outcomes as implementation outcomes, service outcomes, and then kind of at the far end, client outcomes. So that could be satisfaction, functioning, or symptomatology. The other conceptual model that we find helpful in framing our work is a widely referenced model of implementation, developed by Greg Ahrens and outlined by Greg Ahrens and his colleagues. And folks may know it often as the EPIS model, that really refers to multiple phases of the implementation process. So the exploration phase, the preparation phase, so exploration when there are decisions about what are the whats, and decisions about what EBPs may be implemented. Preparation is prior to active implementation. Implementation, meaning that active implementation. And then I think a number of you have indicated that you are involved in implementing more than 12 months or longer. So many of you may be kind of in that sustainment phase where the preparation has happened, the initial preparation has happened, the initial launch of evidence-based practices has occurred, and you're looking at sustainment. We also look at both the outer context and the inner context of influences on these phases. So outer context really referring to systems, political context, funding, and inner context being related to that organization or program. And I'll come back to that again. So I'll start by just giving an overview of the 4KEEP study. And this is, again, a collaboration between UCLA and UC San Diego, funded by the National Institute of Mental Health and conducted in collaboration with the Los Angeles County Department of Mental Health. So I first want to start with the context, and then I'll tell you what we're studying. So briefly, Los Angeles County Department of Mental Health is the nation's largest county mental health department, including 75 directly operated sites, close to 300 contracted agencies, with many of them delivering children's mental health services, which is the focus of our research. The county is broken down into 8 service provision areas that are very geographically diverse, going from rural to really urban city communities. And the population is really limited resources typically and are ethnically diverse. So many folks may be familiar with the passage of Proposition 63 in California, which really levied a tax, a millionaire's tax, that provided a funding stream for mental health services. And within that, the Mental Health Services Act, there is a program within it, the Prevention and Early Intervention program, which really aims to intervene earlier in the context of mental illness. And this was implemented across California. Counties developed their own plans to implement the Mental Health Services Act and PEI, or the Prevention Early Intervention. In LA County, it's often referred to as the PEI transformation because it significantly changed the organization of mental health services, or the financing of mental health services. So this was launched in 2009. After a considerable bit of planning, where it was identified, a number of evidence-based practices were identified to meet the needs of the client population in LA County. And they used PEI funds to reimburse delivery of specific evidence-based practices. So at this time, contracts with agencies were amended where providers, the agencies could bill to one of 52 approved interventions. There were 6 EBPs that are selected and supported by the county for children's mental health services. A little bit of context for this transformation is that this occurred in the context of a very significant state budget crisis in which the mental health funds for mental health services were being rapidly and significantly cut, and many agencies were looking at closing their doors because of these funding cuts. When the PEI funds came along, it really provided the opportunity for agencies to have another funding source for delivering mental health services. And this PEI transformation happened very, very quickly. So thousands of therapists were trained in multiple evidence-based practices starting in 2010 over a very brief period of time. And so there was really a quick ramp up of these practices. So in Fort Keeps, we have 2 studies actually funded by the National Institute of Mental Health. I'm going to focus on our sustainment study. Our sustainment study is really a neutral observational study investigating the sustainment of the initial 6 practices that were supported by LA County DMH in their initial implementation. So they organized the training and launched for therapists. And so our goals are really to characterize sustainment outcomes. And we do that in a couple of different ways. I'm going to show you most focused on kind of the reach of the individual evidence-based practices over time. And then we're also using mixed qualitative and quantitative methods to really understand the inner context factors, so those organizational provider level factors that relate to sustainment and determine those outcomes. And so just to illustrate that, applying the conceptual model is that we're really focused on the sustainment phase coming in. It's been close to 9 years post initial implementation. And we're looking at primarily inner context factors that are potential determinants of sustainment. So how we're applying the Proctor model of implementation research is the evidence-based practices that we're examining are multiple evidence-based practices that were required to cover the targets of the clinical needs of the children and their developmental levels. So there are practices that are for younger children, older children, and target different presenting problems, including trauma, conduct, etc. And so the implementation strategies that we're really examining are fiscal mandates or fiscal incentives for delivery of evidence-based practice. Also, the county provided significant technical assistance and monitoring of the implementation. And then we're looking at sustained implementation outcomes over long term. So first I want to share with you how we are, one of the many ways that we are looking at characterizing sustainment. So we, in collaboration with the county, have extracted many millions of fiscal administrative claims for the 6 practices of interest that were initially supported by the county and continue to be supported by the county. And so we really wanted to take advantage of this rich administrative data and look at how long their individual therapists, after they start delivering at least one of the practices, how long they continue to deliver at least one of the practices that they're trained in, and what predicted therapist level sustainment. And our interest in this is really kind of related to that return on investment. So there's significant investment that is provided at the county level and at the individual agency level to train up individual therapists. So we had 19 fiscal quarters, or close to almost 60 months of claims data from the PEI transformation. And these data represent 2.3 million claims for close to 7,000 therapists delivering at least one of the 6 practices in close to 90 agencies. And what we found was that, first of all, therapists were delivering more than one practice. So on average, 2 EBPs therapists were delivering over this period of time, but they ranged, of our 6, 1 to 6 practices, with over 65% delivering more than one. And we found that any one therapist, they averaged continuing to deliver at least one of their 6 practices for close to 22 months. So we framed this in kind of survival time, but really, once a therapist was trained in at least one of them, they continued to claim for that practice, or at least one of the practices, for 22 months. And what we saw is that there is some variability in the individual practices of how long the therapists would continue billing. So we also looked at predictors of sustainment, and we found that there was multiple levels of predictors. So there was clearly therapist level factors, which were associated with lower risk of discontinuing the evidence-based practice based on discipline, being able to deliver therapy in Spanish, and their own demographic characteristics. We also found that those that were delivering fewer EBPs had a lower risk of discontinuing, and those that were claiming for more agencies had a lower risk of discontinuing at any time. There were also case mix factors that seemed to be associated, and so those included client age and where therapists were where therapy was being delivered. We also wanted to look at program level sustainment, and so we applied mixed methods of sustain or continued delivery of these specific practices. And so we gathered data from close to 200 leaders at about 60 agencies that were contracted with LA County DMH that were delivering one of, oops, I'm sorry, I got ahead of myself there, that were delivering at least one of these practices, and typically more than one of them. And basically, we first started at looking at how many of these agencies reported ever using a practice. And you can see from this slide that there was variability. So most of these programs reported using MAP, trauma-focused CBT, seeking safety, and fewer were using CBITS, CPP, and Triple P. And then there was variable sustainment of those practices when they were adopted. So for example, most programs that adopted MAP continued to deliver MAP over a number of years. Same thing with trauma-focused CBT and seeking safety. And we see less so with CBITS. We also wanted to look at predictors of continued delivery of these practices. And what we found was that really predicting any sustainment is that smaller agencies had a higher likelihood of continuing to deliver a practice, and that positive leader perceptions of an individual evidence-based practice were really related to a greater likelihood of PE or a sustainment of a practice. We also looked, and that was from surveys. We also looked at qualitative interviews to identify themes in what factors related to an individual practice being sustained. And really the big theme that came out is EBP fit. So, and at multiple levels. So looking at the fit with an individual practice with the clinical needs of the population served, the practice modality fit, so group versus individual, and the fit with the requirements, the implementation requirements of that practice. We also identified that there were perceptions of the organizational context and workforce considerations that were really important as well. And so that included having champions, reducing turnover, really kind of aligning the assignment of specific evidence-based practice to an individual therapist professional goals. And then, not surprisingly, the availability of ongoing training supports and consultation. So that was particularly important at the program level sustainment. So I'll just very briefly mention that if we think about the system level, we can look over time to see that that these practices, that overall we see a quick ramp up of the delivery of these practices, kind of leveling off, and then some reduction on these practices, but that they're variable. And I just want to put a nod to the importance of the outer context, especially since many of you are involved in kind of at the administrative level of that funding source matters for EBP sustainment. So in this graph, you'll see that we're looking at the availability of funds that are outside of PEI have increased over time, and then the use of PEI funds have decreased with that increase in other funds. So something that we're interested in, we've been characterizing, what I've talked about today is characterizing sustainment at the claims or administrative level. What we have not yet measured is the extent to these practices are being delivered using other funding sources. So it is possible that these investments in evidence-based practice under one funding source generalizes and spreads to other funding sources. So in conclusion, I really just want to highlight that when we think about sustainment, that we're looking at multiple levels of sustainment. So system level, program level, therapist level, that there's multi-level determinants, and kind of depends on that level that we're looking at of what are the most important factors, which then leads to different targeted implementation strategies that Jared is going to talk about. I do want to really emphasize the role of fit, the fit of the EBP across levels, which really highlights the role of thoughtful selection initially and really strategic continuation of evidence-based practice based on client composition, for example, characteristics of your workforce, and so forth. So I will end with that focus on strategic selection and turn it over to Jared.
Great, thank you. And just a reminder to the audience that if you have any questions for Dr. Brookman-Frazee, to use the Q&A pod to submit them, and we'll have a dedicated session at the end for Q&A.
And if you could make sure that you're submitting them, if it gives you the option directly to Jared Martin, that would be great.
Great. Okay, so I want to start with this quote, which I thought really captures sustainability and sustainment and the issues surrounding it. So, most efforts to install a new practice are ultimately unsustainable. A significant contributing factor to this inability to sustain is a failure to adequately consider and adjust the host environment. So what I'll be talking about is your organization and or your host environment and what it might be want to consider in order to make those adjustments. So Dr. Berkman-Frazee introduced the EPIS framework. This is another representation from it from a recent paper that was put out. I'm not going to go into too much depth into this image. And also, please know that the CEBC has done webinars, many webinars in the past on the EPIS framework, so you can access those webinars on our website. But really the reason why I'm showing you this image is that what it's trying to convey is that implementation is a phase-based process, and that this process is influenced by factors from within your inner setting and your outer setting. So it's important to recognize that sustainment is connected to other phases of implementation like exploration. And that's when you're identifying that you have a service problem and that you're selecting an intervention to address that problem. So Dr. Berkman-Frazee really stressed the importance of having a good fit with intervention with your service setting. So this is also really trying to drill in the importance of that point. So the exploration phase should be, is really where you're laying the foundation for your sustainability efforts. So what that looks like is typically doing a data-driven needs assessment, looking at that data to match that with available programs or interventions, and then looking at the interventions that are potential or worth adopting, and then examining if they're acceptable to your population, to your service setting, to your workforce, and also your capacity to do it with fidelity before you make the decision to adopt. So again, we have numerous resources on our website that you can access to learn more about this process. There's also standardized program fit measures that we highlight on our website. You can click the link on the PowerPoint slides. I don't think you can do it at this moment through the Zoom client, but when we post the PDF versions of the slides, you'll be able to click the links directly. And then also keep in mind that some interventions on our website do have pre-implementation assessments that work with organizations that are interested in the program. So it's not for every intervention on the CEBC, so keep that in mind, but it's usually just for ones that are rated a 1, 2, or 3 on our scientific rating scale. And so these are assessment methods that look at your readiness to adopt the program and some of those important organizational characteristics. Okay, so who's going to be doing this work while you're all your efforts to sustain? So it's important to have an implementation team to monitor the intervention and respond proactively to problems. So the CEBC often suggests forming a team during your exploration phase, but membership and tasks will evolve throughout the process of implementation. So the needs of the sustainment phase can be viewed as continuous quality improvement. So who are individuals in your organization that you might consider? So look at your senior leadership, site managers, supervisors, key practitioners or staff that can represent your workforce. Existing quality improvement staff, if you have any, and then someone who can record meeting minutes and follow up on those action items that you create. So really to drill in the importance of leadership involvement in sustainability. So research has found that agency leaders need to develop a strategic climate for implementation. So leaders help implementation efforts by securing resources, supporting direct service staff, problem-solving issues, and then also collaborating within that outer system or outer context. So make sure you select the right leaders. So make sure that they have the authority to make decisions and also that they have the time to be able to dedicate to this work. You also want to make sure that they strongly believe in the new program, that they're passionate about it, and that they also value data and use it to problem solve. So there's a lot more to be said about leadership and implementation, and The CVC has also hosted a webinar on this topic conducted by Dr. Greg Ahrens, and he talked about his work around implementation leadership. You can access that on our website. He's also developed an implementation leadership scale that you can download, and that examines your leaders, different types of leadership skills that you might want to be looking at. And then finally, the National Child Traumatic Stress Network has a senior leader guide that's available for free to download if you're interested. You do have to set up an account with their learning center if you wanted to download it. So I have another poll question, which is, what is the biggest barrier to sustaining an evidence-based program in your setting? So I'm going to go ahead and launch that really quick. Okay, so the response, the options are A, lack of capacity, B, lack of political community support or buy-in, limited funding for C, D, staffing, such as turnover, training, or resistance. Or NA for E if this doesn't apply. So I see responses are coming in. They're starting to slow down. So I'm going to go ahead and end the poll so we can move on. And then I'm going to share the results. So it looks like about 50% of you said staffing, so issues of turnover, training, and resistance. So that's good because I'm going to talk about that. And then that's followed by both limited funding and resources and lack of capacity. Great, thank you. So moving on. So there are issues that will arise once you make the decision to adopt and you start implementing. So these are some of the barriers that many of you have indicated are issues within your setting. So I'm just briefly going to touch on most of these, and then I'll talk more about what are ways to address these issues, what are strategies. So first, staff resistance. So multiple studies have shown that less favorable attitudes are less likely to adopt a new practice. So resistance may be a result of many factors, including recent organizational changes leading staff to feel change fatigue. Staff might view the EBP as a personal affront to their performance, or that their previous work was not valued by the organization. There's also the issue of low enrollment in the EBP. So that could be because of lack of referrals, unclear or minimal communication, practitioner forgetfulness. So we'll talk more about that. Also turnover. So staff turnover rates are often high in human services and are an ongoing concern in managing programs, resulting in poor staff morale, high stress environments, inconsistent services, increased costs of training new staff. So it sounds like that is an issue for many of you on the webinar. And then finally, program drift. That's the deviation from implementing the EBP as it has been designed and intended. Also known as low fidelity. So programs that are implemented with high fidelity are more likely to have the outcomes comparable to the original study. So changes to the program can jeopardize those outcomes. So that could be as a result of deliberate changes made by the staff because of components that they disagree with or that they don't like, or there might be clients that are resistant that pressure the practitioners to change the program. Or it could be an issue of practitioners just not using the skills or the agency not having the capacity to implement all the activities of the intervention. So I'll talk more about modifications, both unintended and planned. So before I do that, I want to introduce the concept of implementation strategies. So those are defined as methods or techniques used to enhance the adoption, implementation, sustainment, and scale up of a program or practice. So there are many different types of implementation strategies. So they span from dissemination all the way to scaling up. Research has identified 73 discrete strategies, and these strategies can be used for very specific barriers. And so I'll talk more about individual strategies, but certainly I'm not going to be able to talk about all 73 strategies that are available. If you are interested in learning more about these discrete strategies, you can access this research paper that was put out by Byron Powell. It is open access. It is, which meaning it's free to download from the Journal of Implementation Science. keeping in mind that it is a research article, and so that is the intended audience, but it might still be helpful for your thinking around planning implementation strategies and solutions. So for the duration of the webinar, I was going to kind of approach this from looking at the sources of potential data that within your agency, and then what are strategies that you can use. So for each of the issues that I talked about in the previous slide, what are data sources that you can look at? So attitudes or beliefs of your staff should be assessed prior to implementation. So ideally during your exploration and your preparation. So there is an attitudes towards EVP scale that measures, it's a brief measure that looks at 4 dimensions. So those dimensions are intuitive appeal, likelihood of adopting the EVP given the requirement to do so, the openness to it, the new practice, and then also the perceived divergence of usual practice with research-based interventions. So other sources of information could also include past performance evaluations, which could be used to identify those with favorable attitudes towards supervision and openness to learning new skills and receiving feedback and coaching. You may also want to consider conducting staff interviews or focus groups to assess their attitudes and beliefs towards the model. So for example, you could print out copies of the fidelity assessments, show them to the potential practitioners, and ask for their thoughts and reaction to the fidelity requirements. So what are potential strategies to enhance staff buy-in? So it should come as no surprise that there is no magic bullet to change attitudes and beliefs overnight, but there are some potential strategies. So consider being transparent throughout your process of adopting this new program. So how you present the program will shape how staff, how receptive they are to it. So adoption and implementation of a new program shouldn't be secretive. Staff should have as much information about the new program as possible and as soon as possible. Also, you might consider identifying key influencers among your direct service practitioners, such as senior clinicians who are well respected, who you can then recruit as EVP champions among your practitioners. So these influencers can then help promote staff buy-in. Also consider developing criteria that screens for staff members' willingness and comfort in using data to improve their delivery of services, and also assess their ability to respond to and apply coaching lessons towards improving their performance, as well as their confidence and ability to learn new skills. And then finally, this last bullet point kind of gets at the larger topic of organizational culture. So I'm sure many of you know that culture is a very powerful force in in shaping how staff will respond to any new type of organizational efforts. So leaders play an instrumental role in influencing culture. So a leadership style associated with successful implementation and sustainability is transformational leadership, which is the ability to inspire and motivate others in the organization and to follow an ideal in a particular course of action. So again, you can learn more about implementation leadership by accessing the webinar recording that I mentioned earlier. And then in terms of monitoring the use of the program, what are some potential sources of data? So if the program has standardized screening and assessments to determine client eligibility, if so, are the clients who meet that criteria then accessing the program? How many number of referrals is the program getting, and what's the referral source? Do supervisors and practitioners meet regularly to review individual cases? If so, doing chart reviews, case reviews can help determine if an individual client would be appropriate. Also consider conducting staff interviews or interviews with community partners to assess their awareness and the knowledge of the program. And then finally, do clients perceive the program as irrelevant to their needs? When in fact it would be beneficial for them to learn the new skills taught by the program. So you can assess this by looking at client satisfaction, engagement surveys, or interviews. So what are strategies to promote the use of the program? So research has found that laying policies and procedures that expect, support, and reward use of the EVP it is really critical to using the EBP. So expectations, you want to make sure that you're clearly communicating to individual staff their involvement in the program and what that looks like. So role clarity will be critical for existing staff. And then obviously when you're hiring new staff, you're already setting that expectation. And then in terms of supporting the use of the program, are there structures in place to support appropriate client referrals, such as clear communication and from intake staff to practitioners? If you do have intake staff, do they have proper training and receive feedback for appropriate client referrals? It may also be a good idea to hold internal meetings targeted toward different stakeholder groups to teach them about the program. If you're receiving community referrals, have a trained person meet with providers in their practice setting to educate them about the program. Or if appropriate, consider doing mass media campaigns to spread the word. When it comes to supporting your direct practitioners, think about, do they have what they need to conduct the sessions? For example, are program materials well stocked and easily accessible for staff? And then in cases of practitioner forgetfulness, consider using a reminder system, either electronic or from supervisors doing supervision meetings when discussing cases. Also keep in mind that the early implementation phase is often considered the awkward phase of implementation because practitioners may struggle with the newly learned skills, or they may deem clients inappropriate to the practice when they could actually benefit. So practitioner coaching is really important, and also role play could be beneficial. So think about contacting the program developers in terms of accessing coaching. They may already provide it. But in some cases, you might want to consider having internal groups, so more experienced practitioners offering like a internal supervision meeting. And then establishing rewards. So think about simple, basic ways that you can create incentives or recognition for practitioners who are using the EBPs. So you're really reinforcing the use of it. It could be recognition certificates, professional development opportunities. If you have funding, perhaps incentives like gift cards or to businesses that staff like. So now kind of transitioning over to staff turnover. So what are potential data sources for examining if turnover is an issue? So consider looking at voluntary staff departures, the length of employment, the reason for turnover, exit surveys, asking them why that they're turning over. Are there any intentions to turn over? So this is when employees intend to leave or stay at the organization. So are they actively looking at another job for another job at another agency? And if so, why? Consider looking at caseload numbers, and also assessing for the larger cultural and climate. So there are measures that have been developed that you might consider using. So these are specific measures that are available that you can access, and I believe most of them are publicly available. So what are strategies to address turnover? So first, the CEBC has a dedicated topic area of programs that address workforce issues in child welfare and mental health. So only a few have been rated by the scientific rating scale. But of those that have been rated, there is one that addresses organizational culture and works to improve staff retention. It's called Availability, Responsiveness, and Continuity. The acronym is ARC. So you can learn about ARC by accessing the CBC website. There's also other ways you can address organizational issues. So research has shown that high empowering organizational climates are associated with lower turnover intentions. So for example, this might include opportunities for professional growth and advancement for your staff, providing role clarity, fostering a sense of fairness, providing intellectual stimulation and individual considerations such as schedule flexibility. There's also a strategy called task sharing, which refers to the redistribution of tasks among workforce teams, often from a few highly trained practitioners to a larger contingent of practitioners with less formal training. So many of us have seen task sharing when we visit the doctor. So think about you're first seen by a medical aide who takes your vitals and other basic information so that the doctor can focus their time more on specialized tasks like diagnosing and treatment. So this might assist with supporting practitioners with high caseloads. And then finally, there's training for trainers. You might have heard this or already have it in your agency. So this is a program or course where individuals in a specific field receive training in a subject and instruction on how to train, monitor, and supervise other individuals in the program. So some established programs have trained the trainer models, so you want to reach out to your program developer to learn more about that. And then finally, looking at what are data sources to monitor adherence to the program. So the obvious one is fidelity assessment measures. So looking at that as a potential data source. Also consider client satisfaction surveys, but you'll want to make sure that the types of questions that you ask provide information that you can actually use for quality improvement. So a general "how are we doing" survey most likely won't be helpful for your implementation teams. So for example, consider asking if parents in a parent training program think the group facilitator gave enough time to complete activities, were the skills taught in a practical and easy to understand way. So really getting at what is the root of their satisfaction. And then what are strategies to support fidelity? So first, there's audit and feedback. So the organization collects and summarizes practitioner performance data over a specific time period and then gives the practitioner and administrator, they give that data to them to monitor and evaluate and modify practitioner fidelity. There's booster trainings and coaching. So research has shown that without ongoing follow-up or support after initial training, the effects will diminish. So program developers may already provide booster training, but also consider peer consultation or supervision groups. These may also be less expensive alternatives to retraining staff. And then there's also shadowing other experts in your organization. So this could provide ways for key individuals to directly observe experienced practitioners engaged with or use the skills that low fidelity practitioners are struggling with. And then finally, there's learning collaboratives, which you may have heard of, but learning collaboratives facilitate the formation of groups of providers or provider organizations and foster a collaborative learning environment to improve implementation. So there's the Breakthrough Series Collaborative, which is a very specific type of learning collaborative that has been studied and found to be effective. And that's a method that includes bringing together teams from multiple programs who participate in learning sessions and briefer check-ins facilitated by one or more experts in focused areas of change. So there's action periods that take place between the learning sessions, and there's check-ins allowing time for each team to implement new ideas and that were identified during those meetings, and then study the effectiveness of those ideas using a plan, do, study, act cycle. So there may be situations where adaptation is needed in order to sustain the program. So there's some general guidance that we wanted to make sure that everyone keeps in mind when they're thinking about adaptation and modification. So first is that you want to be careful with this modification process, because core components, changing those core components might lessen the program's effectiveness. And you really don't want to do this without some sort of guidance or support. So reach out to the program developers or researchers that are within your community who might be able to assist you with making sure that the adaptations don't have any unintended consequences. And then going back to that exploration phase, thinking about when you're doing the program setting fit analysis and looking at, do we need to make changes to this program, and planning those changes in advance so that you can actually make sure that they're done carefully and that they're not going to be done after the fact, which would make things a little bit more challenging. And then finally, there's research evidence that suggests it might be helpful to actually first try the new practice as it was originally designed prior to making modifications. So in one study and a follow-up study, researchers found that parents from a variety of diverse backgrounds rated parenting skills and strategies that were part of the EBP as much more acceptable than practitioners initially thought they were. So consider trying the program first as it's been designed. But in some cases, adaptation is needed. So there is some guidance that's been put out recently by the National Cancer Institute, which looks at kind of broader implementation science research. So these still apply. And they broke down the guidance into 3 levels. So there's green light, yellow light, and red light changes. So the green light changes are usually the safer ones that you can make. So this is increasing the receptivity and participation of the community. So they give some examples. Cultural relevancy is usually safe to do. So making sure that images contain pictures of your target population, or updating statistics to reflect their needs. But then moving towards yellow light changes, this is when you're modifying or adding components or content. So that's getting a little bit more riskier, but when you get into red light changes, this is more of the concerning area, and that's when you're modifying and removing things from the core components. So they give some good examples there, so keep this in mind when you are thinking about adaptation. So really quickly, I wanted to talk about, we talked about many different types of strategies, and so it's important to be thoughtful about how you choose a strategy. So strategies are not one size fits all, and you also don't want to adopt a kitchen sink approach, which could result in a waste of time and resources. So your data should really reflect and indicate the type of solution and strategy that you're going to use. Keep in mind that some of these strategies have been designed to improve a specific outcome. So what does your data indicate is driving your implementation problem? And then also keep in mind that some strategies are operationalized and administered a specific way. So I mentioned learning collaboratives. Do you have the capacity to conduct the strategy as it's been designed and found to be effective? And then lastly, consider if there's support available for the strategy. So are there individuals who can help you tailor the strategy? Are there facilitators in your community, or someone who's a data expert who can help you with your data collection or analyzing it? So these could be your program developers, or it could be a local university or a technical assistance provider. I have an example. I'll just flow through it. So we have Ask Why 5 times as one way to kind of think about how you go about your strategy selection process. Looks like we're kind of running out of time, but this gives you a sense of one example where the parent training program, which has been recently expanded, has low enrollment. And so in this example, your team, your continuous quality improvement team, would be asking why and pulling data 5 times. It doesn't necessarily have to be 5, it could be 3, it could be 6. But really the idea is you're getting at the root cause of it. And so in this case, the low use of the program is because the practitioners didn't know about it. So the strategy is targeted outreach to case managers and supervisors conducted by intake staff. So I'll wrap up with, I thought this was a really great quote from a resource that the CEBC put out recently on contracting EBPs. This is from Tulare County in California and their Health and Human Services Agency, where they say it is the CWS practice to develop a collaborative partnership with our service providers and closely monitor their contracts. CWS meets monthly or quarterly with most service providers to review performance, spending patterns, and discuss any strengths or challenges. We've learned devil is in the details. When issues arise, it is important to gather all the details so that we can look at the real problem and develop well thought out solutions. So I think that this kind of hits at some of the main points that I make in my presentation. I'm not going to talk about these in the interest of time, but this is just to give you a sense of established sustainability tools. Some of them have published psychometrics, some of them do not, so keep that in mind. And then also some of them are publicly available, and when they are, I have included the link in the text so that you can access them. So with that, before we hand it over to Molly, I'd like to have a Q&A session if there's any questions from the audience. So 1 second.
So we do have one question. Somebody wants to know if they will have access to the reference list.
Yes, so actually after this slide, or in the closing slide, there is some references that I put together. So that will be in the PDF version of the PowerPoint slides when we load it to the website. Looks like we have, oh yeah, so current time is 10 o'clock. So we're gonna go ahead and wrap up. So I'm gonna hand it over to Molly to close this out. Thank you, everyone.
Yeah, thank you, Jared Martin and Dr. Lauren Griffin-Frizzi. You can see that you can sign up for our CEBC email alerts by clicking the link above. You can contact us at info@cebc4cw.org, and make sure to follow us on social media. We're on Facebook, LinkedIn, and Twitter. And be sure to look out for an email that you will receive shortly with a link to a survey about this webinar. And in that, you will find at the very end a link to the certificate of attendance for this webinar as well. And we will also be posting the recording of this webinar as well as a PDF of the PowerPoint slides within the next week or so. So we'll send you an email when that is posted. Thank you, everybody.